Hello, Remote Clinicians. This is Dayan, and I'm joining here today live with Dr. Sharona Dayan, my favorite periodontist and friend and colleague who done a couple of other video tutorials here with you guys. Sharona, thank you so much for joining me again.
Ali, it is wonderful to interact with you again. I enjoyed our last podcast so much on the topic of diabetes, and you are just one of my favorite conversationalists. So
that's so wonderful of you, Sharona. That topic of diabetes was so helpful to so many of the audience of our audience. They emailed me so many nice comments and so many wonderful accolades for all the way you can help them out. And today, what I wanted to do is I wanted to have you back because I know you have been, your never-ending kind of quest for knowledge and so on. If you, as we know, just your background here, you did your dental school at UCLA, and then you did your perio program at Harvard, and then you got also a DMSc with the doctor in oral biology at Harvard, and went on to do all kinds of different training at COIS and at Mission Institute and so on. And now you are, from my understanding, is you're also doing a lot of research and work in the area of vitamin D and microbiome, which is an area I'm very interested in. And the reason for that is because I take my vitamin D every day since COVID. And also in light of the new events with even our president catching COVID and so on, but thankfully getting over it and now feeling better. Vitamin D is on everybody's mind, and I wanted to have you as someone who's really well versed, not just in that topic, but its correlation and its relationship with the oral health and overall health, to just discuss it with you. So I'm not going to talk too much. I want to just kind of pass the floor to you, and I want you to tell me a little bit about vitamin D and why should our audience be interested in knowing about vitamin D and taking it every day.
Sure. The way that I fell into vitamin D was I began to notice in the last couple of years that my patients with really severe gum disease, periodontal disease, also had sleep apnea. So I began to look into the relationship between sleep apnea, periodontal disease, and learned that vitamin D runs our sleep. And vitamin D is necessary for so many of our functions, whether it's sleep, our metabolism, it controls calcium and phosphate homeostasis. And if we think historically, vitamin D has evolved over several hundred million years. The oldest organism that we know with a vitamin D receptor is the jawless fish, the lamprey. 550 million years ago had vitamin D receptors. So we have evolved over time to use vitamin D for our survival because it is the link between sun exposure and our bodies. So in the winter time, when the sun exposure is more limited and food is more scarce, vitamin D makes us hibernate so that we conserve our energy, and one piece of meat might have to last us for several weeks. So vitamin D runs the thyroid, reduces our metabolism, and it's a big survival advantage.
Yeah, and the role of vitamin D and sun exposure, and we know that there is vitamin D deficiency as almost as an epidemic issue, and especially in areas where people do not get as much sun, as you go into the northern climates. How does that play a role into, obviously we all learn in dental school and medical school about the importance of vitamin D with bone formation and so on, and osteogenesis. But what else is it that we need to know about, and how does that work out with this whole COVID thing and microbiome?
Absolutely. Yes. So any animal, whether it's an insect, a bird, a fish, or mammal that makes cholesterol and is exposed to sunlight makes vitamin D in the skin. And over the last thousands of years that we have developed a microbiome, the microbiome automatically, spontaneously forms. And the microbiome, I'm referring to the trillions of viruses, fungi, bacteria that live on our skin, in our sinuses, in our mouths, in our gut, that protect us and also help us with many of our daily functions. So our healthy microbiome. our healthy microbiome spontaneously develops by age 3 months in babies whose mothers have sufficient vitamin D levels and are outside. So that is how the microbiome develops. And the microbiome is so important for us because we have about 22,000 genes, which if you think about it is really not a lot for the complex organisms that we are. So these trillions of bacteria, viruses, and fungi expand our genomic repertoire and expand the proteins that we are able to synthesize for survival. Prime example is vitamin B. So vitamin B is made by the microbiome, and vitamin B is involved in digestion, in sleep, in immunity, in metabolism, and that's one of the ways that the microbiome, which relies on vitamin D as a growth factor. So when the D goes low, we lose the microbiome as well. And with COVID, that we've been indoors more, we're not even getting that, 30 minutes of sun exposure, walking to the car, walking to the office, walking to run an errand. So it's estimated right now at least 70% of the population is vitamin D deficient, and it's having a lot of health consequences.
The understanding of the important role of biome in our overall biology and our homeostasis has just more recently become clear. And, as they say, about 5 pounds of our body weight is the microbiome, and that is essentially an organ that if you don't have, you would be having problems with it. So what about COVID? Where does that come into effect with vitamin D and the immune system?
Mm-hmm. So vitamin D impacts our immune system in a few ways. It runs the innate immune system. So the immune system involving macrophages, dendritic cells, antigen-presenting cells. So it enhances the bactericidal ability of these cells. So that is one of its primary roles in the innate immune system. But also, like I said, vitamin D runs our sleep. And we know now that if you routinely get fewer than 8 hours of sleep, your immune system will get compromised. And it's a bidirectional relationship. We need our sleep to have a strong immune system. And also when we get sick, we want to sleep, and our body just kind of forces us to go to bed because the sleep is part of our healing. So that is the second way that vitamin D affects immunity. And the third way is vitamin D, which is responsible for growing the microbiome. Microbiome makes the 8 vitamin Bs, and of those, vitamin B5, pantothenic acid, in the brain makes acetylcholine, which runs our rest and digest parasympathetic system. And in the adrenal gland, it makes cortisol. And we need cortisol to even out the immune system to make sure that the switch gets turned off when it needs to get turned off, and we don't turn into this kind of chronic inflammation that we all know now is so bad for us. So it also is an immune modulator to make sure that the immune system stays in a healthy balance.
Terrific. So with these multiple actions, these beneficial actions that vitamin D has, for those who can get the sun, we would probably recommend that they go out in the sun and get some sun because it activates the vitamin D. And for those who can't and are, much like most of us in the dental field who are sitting in the operatory all day long, would you recommend that we actually turn the dental light into our faces for a little while, or take some vitamin D supplements? Which one do you think would be more?
So this is a really good question. And everybody metabolizes vitamin D differently. So people who are from the northern latitudes, like Ireland, like Scotland, like Canada, have actually evolved so that with the limited amount of sun exposure that they have in the summertime, they make all the vitamin D that they need for the year. But people who are from warmer climates, the Middle East, people who have darker skin actually need more vitamin D because we have evolved to be out in the sun a lot more. So we need more vitamin D. And my advice to everybody would be to supplement knowing what your blood levels are. So what are the blood levels that we need to look out for? According to some of like the older ways of thinking, vitamin D levels of 30 nanograms per ml were sufficient, but I will say that's been shown not to be sufficient. For bone metabolism, you need at least 50, and for sleep, you need 60 to 80 to be able to go into the deep reparative stages of sleep. And I would refer all of your listeners who are interested in sleep dentistry to Dr. Sasha Gomanak. She is a Harvard-trained neurologist who, based on her research, really uncovered the requirement of vitamin D and B for sleep. And she has a 2-day course for dentists that is phenomenal. So I think anybody who really wants to help patients with their sleep should look at her website and see what she has in terms of her teaching. So 60 to 80 is really where we want to be. And since we all metabolize D differently, it's really important to supplement with the knowledge of what your blood levels are. And it's not even necessary now to go to a doctor's office, because I know some people might be avoiding that. To get a vitamin D level, you can buy a test online. I refer my patients to altawellness.com, and it's around $40 to have a vitamin D test. And you go to the nearest lab, it takes maybe 20 minutes to do the draw, and they email you the results. So you can keep up with your summer levels, your winter levels, and supplement accordingly. And children also need to have really good D levels. Acetylcholine, like I said, needs vitamin D for its production. It helps children stay focused during the day. It helps children to sleep at night and release growth factor for growth. And vitamin D helps to keep the nose and the sinuses open and clear so that children can nose breathe instead of mouth breathe. And we now know that really nose breathing is the best way for children to breathe, to have the best craniofacial development. So children and pregnant moms and mothers who are breastfeeding also really should optimize their vitamin D levels.
That's terrific. So from what I recall, Sharona, the vitamin D is probably one of those fat-soluble vitamins. So is it a chance to overdose and take too much? And is that the reason why you're saying it's recommended to know what your dose is so you don't actually take too many? Because nowadays it seems to be there are additional, everything that we eat has some type of a supplementation. There's some additional stuff. I realize that because I do take my 2,000 milligrams of vitamin D. I've been taking that for a long time every day. And then I realized one of the power bars or protein bars that I eat has also like a high percentage of vitamin D. And then all of a sudden I'm like, well, wait a minute. All of these things add up. So what do you think would be, what could potentially be a problem if you're overdosing or taking too much of it? And what should people do about that?
That's an excellent question, because too little vitamin D is going to disrupt the sleep. Too much also is going to disrupt the sleep. And yes, it is fat soluble. And in fact, Eskimos get their vitamin D by eating whale blubber and cod liver. So liver, where vitamin D is stored, is a good food source. But other than that, really vitamin D comes from the sun. Vitamin D3, which is what we need to metabolize. Now, we have a built-in safety mechanism that we don't overdose with sunlight vitamin D because we make melanin, and then melanin will limit the production of vitamin D so we don't overdose. But when we're supplementing, it's a different story. And yes, so we need to look for all the different sources of vitamin D. And that is why it's really important to stay on top of monitoring the blood levels.
Yeah, that's absolutely true. So it is important to make sure that you don't end up taking too many sources of vitamin D without knowing it. Now let's talk a little bit more about the microbiome. Any additional, now from going back to your specialty as periodontics and, with me as endo for the most part, that's the realm of what we're dealing with, is mostly dealing with, not so much with the eubacteria, but when they become pathogenic and they cause problems. Any recent changes of, one of my interesting areas that I've seen in the recent past come and develop is the realization that it's the same bacteria, but different people with different genotypes are reacting adversely to the same set of bacteria that might not be causing the same problem in other people. Any other advances in your field in that area that you want to talk about?
Yes, a couple of advances that, I'll start with an interesting story about P. gingivalis. So I'm a periodontist. I deal with bone and bugs. And P. gingivalis is the keystone pathogen for periodontal disease. And it's such a tricky little bug because it lives inside the host cell, inside the human cell. It's intracellular. So it can evade our defense systems, and it's harder to get rid of it. And that's why periodontal disease can easily turn into a chronic situation. Now, vitamin D has an inhibitory effect on P. gingivalis. And in the year 2016, the Nobel Prize went to a scientist who uncovered some of the mechanisms for autophagy, or self-eating. And this has been embraced by a lot of health gurus in intermittent fasting. And the mechanism that vitamin D inhibits P. gingivalis is through autophagy. So the body recognizes that there are cells that are damaged, that are not acting properly, there's something wrong with them, they might even be precancerous. So the body will select those cells to be destroyed via the lysosomes, and then the good parts get recycled, which is very helpful during fasting and during starvation. And so the mechanism of vitamin D, which runs the innate system and runs metabolism, is really interesting in terms of the body's ability to kill the cells that have P. gingivalis, and kind of combining this metabolic phenomenon of autophagy with the innate immune system.
That's very interesting. So the cells that have been affected by P. gingivalis go through autophagy, or is it just basically the same type of phagocytosis of the P. gingivalis cells? I'm not.
Yep, the cells that are affected with P. gingivalis undergo autophagy, and it's mediated by vitamin D. So vitamin D is so important for keeping our normal, healthy microbiome. And then the other way that the microbiome in the gut gets disrupted, I would say currently the two most common ways are the lack of sun exposure and vitamin D deficiency, and glyphosate, the ingredient in Roundup, also damages the gut microbiome and keeps us from absorbing vitamin D.
So for those who don't have necessarily access to what their vitamin D level is, assuming that they're the average population, what would be how many units of vitamin D do you recommend that they should be taking? Obviously related to COVID or non-COVID. kind of prevention and overall health maintenance?
So that's another great question. Vitamin D, so in my practice, the way that I help my patients is, well, vitamin D has been shown the deficiencies also are resulting in hypomineralized bone and hypomineralized teeth, which can result in dental caries and bone loss around teeth and dental implants. And in fact, the pulp also is covered with vitamin D receptors. So there is a possibility that the vitamin D deficiency can also upregulate pulpopathology and recurrent endodontic pathology. So for that reason, in my practice, I supplement my patients for 4 weeks before and 2 weeks after any surgery that involves bone, like dental implant surgery, LANAP, laser periodontal therapy, and even now with soft tissue procedures. And the supplement that I use has 5,000 units. I'm finding that most adults need a maintenance dose of 5,000 units. And some of my patients, it's unbelievable. When they're getting tested, their levels are below 20. And they didn't even know it when they came into the office. So they will do 10,000 units just for a short period of time to just boost them up. And it only takes a couple of weeks, even in a very deficient patient, to get their levels up, and then 5,000 for maintenance. But as you use vitamin D more after a couple of years, when your levels are better, then you might find that you need to take less. So then your maintenance dose might drop to 1,000 or 2,000 per day.
I could talk to you for hours, but we want to usually keep these kind of short. Sharona, do you want to finish on any final words here overall?
Yep, I would also say, I mean, implant dentistry is really big right now, and implant complications are something we're struggling with. And a vitamin D deficiency can result in up to 300% higher early implant failure. Even more than smoking, which we've always thought, oh my gosh, if you want to smoke during your implant surgery, you have to sign this form that, you know, says you're aware of the risks. So I would just ask all the clinicians that are involved in implant dentistry to just really become aware of the situation and to do a little bit of research and to supplement patients to the levels that they're comfortable with. But this is something that all clinicians need to be aware of.
That's wonderful. Thank you so much, Sharona, for joining me again. This was really enlightening and helpful. And I guess we all heard it. I'm going to make sure I'll stick to my vitamin D supplementation and share some really interesting insights about even pre-treatment and after treatment for some of our patients as a potential means of helping stabilize the immune system, as well as many other things. Of course, during the pandemic, I think it's just generally recommended to take it anyway as a means of helping the immune system against COVID. Once again, thank you so much for joining me from Beverly Hills, California. Dr. Sharona Dayan, periodontist extraordinaire, joined me, and I'm really happy to see you again, Sharona. Have a wonderful day.
So much. And Dr. Nasseh, I do offer online coaching for patients who want to get advice about how they can keep their teeth, if they need specific advice about their gum disease, and how to really get specific instructions and coaching on dealing with their own issues. And that information is found on my website, auroraperiodontal.com.
I'll make sure I'll write that out for you in the bottom of your name here as well. And thank you again so much.
Talk to you, Ali.
Absolutely. It's a pleasure to have you, Sharona. Have a wonderful day.
Bye-bye.
For Vivo Dende, I'm Ali Nasseh, and I hope you found this information helpful.